everyone, it's Sima again. I'm going to lead you through a few yoga poses that you can use for bladder pain, or if you have interstitial cystitis, or if you just have a lot of urinary urgency and frequency. So let's start laying on our backs. I'll let you lay on your back in a comfortable position. I like having my knees bent and feet flat on the floor. You can lay with your legs straight out, whatever you want to do. And I also want you to place hands on your low belly. Both hands on low belly, or one hand on belly, one hand on chest. We are going to work on a deep belly breathing. So this will be our diaphragm breath. As you inhale, I want your belly to expand. So if you have one hand on belly, one hand on chest, you can really try to feel for the belly expanding more than your chest moving up. So like this. Good, and you can soft gaze or have your eyes closed as you do this. This type of breath helps to relax the pelvic floor, and it also helps to calm the nervous system and help reduce that feeling of urgency. In this position, you can also pull your knees wide towards your shoulders, grabbing a hold of your knees and your feet, and continuing with that deep belly breathing to further encourage the relaxation of your pelvic floor muscles. The next pose that I want you to try is we will be on our hands and knees. So knees under hips, wrists under shoulders, and you will go through a cat-cow motion. So as you inhale, you reach your head up to the sky. Exhale, chin to chest, round your back. Inhale, belly button reaches to the floor. Exhale, chin to chest. One more inhale. And exhale. Okay, and for this next pose, we will be laying down on our stomach. So I'll show you 3 variations of this pose. And we'll start with the least intense. You'll keep your forearms on the floor, and you'll inhale, bend your back up, reaching your head towards the sky, pushing in through your hands. You'll feel a stretch in your abdomen. And if that feels easy for you, or if your back is warmed up, you can actually bring your hands closer to your rib cage and push up into a higher cobra. And still continuing with the deep breathing in this position, keeping a slight bend in your elbows and pressing your hips closer to the floor to really feel a stretch in your lower abdomen. And push back. For another stretch, you will get into a half kneeling position. So you're like in a runner's lunge. And then lift up the arm on the same side of the leg that's back. So if my right arm is forward, then my left arm will go up, and then I'll reach over towards my right side. Again, to get a really nice stretch in the side body here. And during all of these stretches, you can keep that deep belly breathing that we practiced at the beginning. And let's do the other side. So left leg forward, bend into your left knee, feeling a stretch in the front of your right hip, and then lifting right arm up and over to the left. And deep breathing. Feeling a little bit more of a stretch every time you breathe in. Good. And for the next pose, we will be on our knees. So in a tall kneeling position, my knees are about hip width apart. And then I'll put my hands on my low back like this. And on your inhale, push your hips forward and start to lean your hips back. You can leave your chin tucked into your chest or lean your chin back. And slowly bring chin back to chest. And then bring your hips back up, pushing your hands in. And those will be our poses for bladder pain and urinary symptoms like urgency and frequency. I hope these help.